realities, or speaking to those realities, or even acknowledging that those realities exist. So don't want to face reality. Your loved one is suffering from addiction, and doesn't want to face their reality. And that, sure, and that of their addiction. They cannot see the damage they are causing to their loved ones, friends, families, work, home, or themselves. Facing reality is difficult, painful, and a hard process to work through. It's just as difficult for you as as a family member to accept that the reality that your loved one has the disease of addiction and that they are causing damage in all aspects of their life. Once you can admit that your family member is an addict, your awareness starts to help them in their healing process. Facing the reality that you can't handle this by yourself is painful and difficult as well. So, what we're really speaking to here is not necessarily just that our loved ones are in denial, but very often we ourselves, as loved ones, are in denial of the addiction. And that can play out in many different facets. It can also contribute a lot to enabling behaviors because you yourself just cannot admit it. So you fall into these old patterns. And so, really, what breaking denial is all about is actually breaking familiar patterns. Okay. So, patterns of denial. Denial comes in many different patterns, and there are 12 varying patterns of denial. These patterns are formed after many years of trying to avoid or not face reality. These different patterns have formed as a strategy to avoid. It's a way of deflecting from the truth. I always like to speak a lot about the function of behavior. And so for me, denial, the function there is always avoidance in some sense, or control. But either or, they have the same function, control and avoidance. Every one person displays different ways of deflecting from the truth in order to avoid the hurt or the pain of facing the truth. A lot of the time, these patterns are being used way before your loved one picks up a substance. As family members, you also have forms of denial in either the workplace or family life. When it comes to a loved one, it's hard to accept and admit the painful truth. And the painful truth, and for many of us, is that they are suffering from a disease that they have no control over and we have no control over. And that can lead to many of the patterns kind of being reinforced. So the first pattern of denial, or one pattern of denial we'll speak to, is avoidance. So I'll talk about anything and everything. I'm going to speak to a lot of examples in terms of the patterns of denial, and then just give some kind of explanation to that. So I'll talk about anything and everything else but the real problem. Okay. This denial pattern is very common because as a family member or your loved one suffering from addiction, there is a misconception that if I don't talk about the problem or talk about the problem, it is bound to go away. If the reality is brought up and then naturally a person deflects or avoids the truth, they'll often try to change the subject or create a crisis so the actual problem will disappear. A great example of this for me is a simple one, but nonetheless like a quite, I think, a familiar one in the South African context too. It's when anyone ever brings up something negative, right? And it's almost as if we can talk this thing into existence. That is a pattern of denial, right? So it's like, no. We don't talk about these things because, that can curse us. That can bring this thing to kind of fruition. And so part of challenging our denial is also challenging the way in which we speak about things. That is, in fact, one of the only ways we can challenge denial. And in this particular one, it's really to challenge some of our magical thinking around the pattern. And very often, when it comes to avoidance, we create very strategic but very creative ways of working around the problem. Okay. So absolute denial is one of the most obvious and common forms of denial. It is the first form of denial that comes with addiction. The addict will believe they don't have a problem. It's common to hear, no, not me. I don't have a problem. As a family member, it's also hard to believe and accept that your loved one is using drugs or has a problem with drinking or other process addictions that we're not mentioning here, just because it's not on the slide. So you perhaps might turn a blind eye or refuse that your loved one is acting strange or drinking too much. Deep down inside, you know your family member or loved one has a problem, and have hope that they will just put the substance or drink down and change without needing to go to rehab. The addict also knows deep down inside they have a problem and want to stop, but don't know how to find, don't know how, and find it difficult to voice it or tell someone they need help. Okay, so in terms of absolute denial, uh, and really that's what primary care is all about for a lot of you loved ones inside primary care now. Um, it is really about breaking that absolute denial quite initially because most people walking through primary care go off the presumption that they're not an addict or don't have an addiction or don't have a problem, or really use this phrase, no, not me, I don't have a problem. Um, okay. Minimizing, common one as well, working in primary care. My problems aren't that bad. The addict will minimize the amount they use and the damage they have caused to their family, or at home, or in the workplace. The addict might truly believe that they don't use that much and that they are not harming anyone. This is why it's very important for a family member or a person who is involved in the addict's treatment to tell his counselors exactly how much they drink or use and the exact damage the addict has caused. As family members, you tend to minimize the amounts or damage the addict has caused to you in order for you to not feel it as the effects as much or to accept it. You probably have bailed them out for a very long time. This makes it difficult for us to give the best form of treatment without knowing the details. So a common one that I think we hear with minimizing is around drinking and driving. Especially, when they say, well, I've never been caught, or no, I've never been in an accident, or no, I never really hurt anyone, or no, I never really drove under that much of an influence. So that aspect is a very big part of minimizing. We call it sort of near missing, where they kind of get towards the admission, right? I was drinking and driving, but they kind of speak to the near missing stories, and don't really want to speak to how they constantly ding their cars or sort of the worry that you've, as a family member, really experienced. Maybe they didn't get into an accident, but you might have been aware that they had been drinking and driving for some time, and the anxiety and the panic that might cause every single time they go out. Are they going to drink? Are they not? That is a real consequence that they have to start really grappling with, and it's difficult for them to grapple with when they got it in their heads that it really wasn't that bad because, well, I never got caught or I never really hurt anyone. Yeah. If I can find a good enough reason for my problems, I won't have to deal with them. So this is speaking to rationalizing. I don't, oh, still minimize. Okay. So rationalizing is an attempt to explain or justify one's behavior. I think the rationalizing subtitles missing at the top there. I think it's too high. So this is really speaking to rationalizing now. Rationalizing is an attempt to explain or justify one's behavior or attitude with logical reasons, even if these are not appropriate or helpful. The addict uses rationalizing as a defense mechanism. They know their addiction is becoming a problem, but actually don't want to stop or are not ready to stop. As family members, you tend to rationalize with yourself and others in order to find a good enough reason why your loved one started in the first place. If he wasn't bullied at school, then he would have found, I wouldn't have found the drinking or drugs, right? If I didn't bring him up in a certain way, then he wouldn't have picked up in the first place. Ultimately, the addict uses to feel better because they want to, right? So these are the rationalizations we use. Common one I think I hear is, if I didn't have depression, or if I didn't have bipolar, or if I didn't have some kind of mental disorder, or really the big one, if I didn't have this trauma, I would have not used, right? And so part of our challenge then is to kind of say to them, well, many people go through many different traumas and don't use. So you start to then pick apart what are these justifications or these rationalizations that you are using. You as a family member, might also have some of these rationalizations. If it wasn't for the trauma that they underwent or undergone, they might have not used. If it was for the medication sooner, they might have not been in the situation. Um, yeah, please, by all means.
I think just to add something around rationalization, specifically with all of these, you know, strategies of denial. essentially, if we don't acknowledge our role within, rationalizing our loved ones' addiction, we are at the end of the day enabling them to continue with their destructive behaviors, with their unhelpful behaviors. So just becoming aware of this, and becoming aware that if we continue with rationalization, that we at the end of the day enabling their behavior or continuing, you know, allowing for their unhelpful behaviors.
Mm. Yeah, and if I may add, if we think about us as family members, why do we rationalize? Like, what's our need? You both
Sorry,
mute.
Cheryl. Yeah,
You're muted.
sorry. Um, so am I still muted? No,
No.
cool. I think that as family members, we rationalize because we don't really want to accept. It's continuing that denial. It's like accepting the problem that's on our hands, like also accepting the experiences that we've gone through, trying to hold our family members within their addiction. That's an experience in ourselves that we are denying essentially as well by rationalizing the usage of drugs and rationalizing their behaviors. So like Calvin has been saying, and like we said in the preamble, it's to take responsibility for our own healing within the recovery journey. And so denial is as appropriate to us as is explain as explicit as it is within the recovering addict's behavior.
Mhm. I think we just want it to go away, right? We want to, in our own minds. Um, and I think also we rationalize because if we can find the reason for it, then we can address it or take it away. But as you said earlier, Jordan, it just precipitates the enabling.
Hmm. And I think if we find a reason, we have control. That's the main point.
Yeah.
And if we have control over this thing, then we can fix it. Then we can. But very often, it's something that doesn't have to be fixed, but really has to be addressed, has to be broken,
Yeah.
has to be challenged, has to be um, changed, and can't be fixed in some sense or controlled.
Yep. Okay.
So blaming. Am I unmuted? Okay, cool. So if I can prove that my problems are not my fault, I won't have to deal with them. While addiction is a brain disease and includes genetic, environmental, and social factors, which influences the likelihood of someone developing an addiction, blaming these factors for one's addiction is not helpful and only serves to keep the addict in denial. Family members tend to blame themselves, past friends, ex-girlfriends, work, school, and any past trauma to make it easier to accept the fact that that your loved one is using substances or drinking to deal with these issues. It's also easier to blame anything else but the actual person with the disease of addiction. At Changes Treatment Center, we help the addict deal with their trauma, but fixing the trauma doesn't necessarily mean that the addict will stop using. We assist them to deal with their disease, introduce and encourage them to join and engage in the 12-step fellowship. This assists with them learning healthy coping tools. Okay. One big aspect of blaming, I think, that we see often here is blaming the system. I think, especially in primary care, it's so quick for loved ones to really get stuck in their patterns of denial. The moment it starts being challenged, it's almost to say, no, it's the entire system. You guys are not giving me the right medication. You guys are not giving me this. You guys aren't, my family isn't dropping off my cigarettes. They're not giving my clothes, my vapes, my etc., etc., etc. And that's, a pattern of denial in their life. That's not necessarily um, you know, them using, but it's how their addict plays out in the real world. And that has to be challenged because if they're blaming, so much of their discomfort of just treatment on the process, on the system itself, what do you think kind of plays out in the real world, right? When they actually face real challenges. Not that, treatment isn't a real challenge, but let's say, more real world challenges, worldly challenges, if I can put it that way. You know, the boss, stress at work, family, fighting, etc., etc. And that blame shifting is a crucial aspect of their addiction that needs to be challenged. Screen up, like that. Picture now. Can't see myself. I don't know. That. Okay. Okay. Sorry about that. Cool. Comparing. Okay. Showing that others are worse than me proves that I don't have a problem. Addicts will always try to compare in order to make themselves feel better about their problem. Some people believe that an addict is someone who is on the streets and has no job. It's easier to point a finger at someone else rather than looking at themselves. As family members or loved ones, it's easier to say, yes, he drinks or uses a lot, but he hasn't lost his job, marriage, or his house, or his or her house. Loved ones and or the addict may rely on comparisons so that they can argue that they haven't hit rock bottom. They don't need help, or they only need 21 to 24 days and no form of extended treatment because it's really not that bad yet. Okay. The disease of addiction is progressive, and so one should not feel comfortable that they have reached a particular low in their addiction because they inevitably will, and it's likely that it will be worse than the people they are comparing themselves to. Rock bottom could mean death. Rather put in the work or do a form of extended treatment now while it's still early in their addiction so that they don't reach the point of losing their job, marriage, house, or it's come or has to come back into treatment the following year in a worse state than before. Yeah, we often see, especially in primary care, and you often find because of the disparity in primary care, the patients that have been here for some time start comparing themselves to the patients that have initially been here. And yes, at that point, they may start feeling a bit healthier, feeling a bit, you know, um, more challenged, more strong, more resilient. And then they'll start saying, I can't believe I was in that state. I can't believe I was there. I can't believe how silly I was. But at the end of the day, we still have to point out that that's a kind of comparison, right? Because just because they're now 18 days into treatment doesn't mean that they're not going to go back to that initial phase, right? And so very often they use that comparison of how they're feeling now as opposed to, you know, how early stage patients are feeling as a mechanism to really drive home why they don't need further treatment. Very often they do. So we see comparing, I think, quite often in the later stages, and it's quite a vicious form of denial in terms of trying to get out of treatment. Yeah.
I think it's also just important to note that comparison and rationalization often go hand in hand together. So we'll use comparing to rationalize our own behaviors in those stages. I think I just picked it up like, but I haven't lost my job, or I'm a functioning addict, or I'm a functioning alcoholic. It's like comparing to what people see as dysfunctional. And it's just not accepting that unmanageability, that powerlessness. Yeah.
And I think what Jordan is really speaking to is that there's going to be a lot of overlap between these patterns of denial because normally they function with quite an overlap. They never really exist in isolation. Yeah. Compliance. I'll pretend to do what you want if you will leave me alone. Compliance is following all the rules and doing the bare minimum because everyone is telling you to do it, not because it will help your recovery or because you need to do it for your recovery. Compliance is when the person with a substance abuse problem does the right things or says what they are expected to say in order to convince others and even themselves that they are getting better and are in recovery. As family members, you may get fooled when your loved one is who has a substance abuse problem is saying all the right things and saying they want to change. The question is, are they talking the talk or walking the walk? When someone is recovery and have surrendered, you will see that their behavior is changing and that they aren't just talking about it. So compliance is once again one we see very often towards the end of their treatment, but I think it's also one that is quite a challenge in secondary care, and something that really is a big barrier initially. They may, to you as the family, seem to have kind of surrendered to the process and are, sticking to their recovery process, but really, on some level for them, they're just doing it to make their family happy, right? Or they're just doing it because maybe the family has put in a really strong boundary. We also maybe see compliance in primary care, especially when patients want to leave early or RHT. Um, Family members might also then put in a really firm boundary, and they're just doing it to make the family happy. And so for us, it's very important to challenge that level of compliance, because you're not really doing recovery for you, you're just doing recovery for external reasons, right? You haven't really admitted to you being the problem or you having the problem. It's just, well, let me just do it so I can pretend to keep, everyone happy, and then keep doing what I've been doing in the past.
I think compliance also is appropriate. Well, is like shows up in the loved ones dynamic when you showing up in primary or secondary and you saying all of these amazing things that you're going to set these boundaries in place, and then your words show, but your actions and your behaviors and the actual set boundaries and the consequences aren't done. So for instance, you consistently meet or meet their like losing track of thought, but you meeting all their demands, meeting all of their requests, and when a boundary has been set in, if you don't comply, or if you don't comply with the program, or change your behavior, this will be a consequence. Yeah, sorry, that was really not well worded, but I don't know if Calvin wants to maybe clarify.
No, I think you're 100% spot on the money, Jordan. Compliance, as much as we see compliance and patience, we see it very often with family. Because on some level, I think you guys really want to see them get better. That's what we want, right? And so really everyone wants to see them recover. Everyone wants to see them get healthy. Everyone wants to see the best version of themselves that we know, right? That's why we're here. And so we're so at the ready to just grasp onto, what are the great aspects happening, and then just, yield into their demands because they're simply just sticking to the treatment, and we can see the genuine shift. But that's arguably one of the most dangerous times, right? That is the time when you most need to be putting in boundaries and most need to be challenging them, is to say, okay, well, you're doing well. But that doesn't mean all of a sudden all the boundaries are sort of just disappearing, right? That doesn't mean that all of a sudden all these consequences that we've put in place are just disappearing just because now you're complying. And I think when families do that, when they do put those solid boundaries in, even when there is some kind of compliance, you find that the compliance falls away pretty quickly. And you find that you can really distinguish then between whether this person is working recovery or not quite quickly, right? Because are they getting what they want or not, and how are they reacting to that? Generally, the better reactions indicates that they're sticking to treatment. Yeah. So manipulating. I'll only admit that I have a problem if you agree to solve them for me. Manipulating is a form of getting one's own way. Most addicts have been using manipulation even before they're picked up. They will make sure they get their own way, even if it takes a long time. The addict manipulates their family members for money or to get out of situations. An addict may say sorry, but perform the exact same behavior again and will apologize once again. This is a form of manipulation to get people off their back. Please be aware that when your loved one is in treatment, they will use any form of manipulation to get out of treatment and to not extend their treatment. When you are being promised things you're not hearing, I'm sorry, then it's a form of manipulation to get their way. Okay. So I think what happens from the family side with manipulation is a common one. Is if you stay in treatment, you can get Xbox or a Bucky, or then they say they kind of hold you to these kind of manipulations, right? We had an agreement, if I stayed in treatment or if I went to treatment, you would buy me a flat, or you would be and It's not to say that there can't be motivating factors to their treatment. That's not at all. But it's to be mindful of, what you are allowing in terms of keeping them in treatment or not. Sometimes the best boundaries really are the words no. And no is one of the most effective ways in kind of combating manipulation. So it's just to be mindful of I think what they're trying to elicit from you. Because manipulation, very often, I think the most subtle way of manipulation is through emotions. And patients, I think, here in secondary care, in outpatient, our loved ones really are so exceptionally, profoundly even um, tactical and strategic around how they play on our heartstrings. They know exactly what to say and when to say it in order to elicit this emotional reaction from us. And if you think about it, it makes sense, right? These are our loved ones. They've walked many years with us. They know how to push our buttons. And I think it's important to know when your own buttons are being pushed and be alert to these kind of moments, right? Like, what are they trying to get out of me here? Because I'm having a really intense emotional reaction. If they're in recovery, truly in recovery, and they are practicing the tenets of openness, willingness, and honesty, you won't be feeling these intense emotional reactions as much, as strongly, um, as you have in the past. And I think that speaks to kind of the red herring of manipulation. Jordan, it seemed like you wanted to add, or okay. Fight into health. Okay, so feeling better means I'm cured. Addicts will think this. You're looking so good, you have color in your face, you have light in your eyes, you must be better. This is one we hear from the families. This form of denial tends to happen when someone has been in treatment for longer than 2 weeks or has been in the program in recovery for a while. Addicts start feeling better and may no longer be experiencing cravings. This leads to them thinking that they don't need to go into 12-step meetings or stay in treatment any longer because they are feeling like a new person. As family members, you might see them on a video call or during a visitor time and think to yourself, they're looking really healthy. Maybe picked up some weight, their color is back, or they have a smile on their face. So they must be doing better. Yes, they might be getting better physically, which comes from just putting down the substance. However, they still need to do a lot of internal, emotional, and behavioral work. Recovery is a lifelong process and not just for 3 weeks or a few months. As much as the addict needs to be going to 12-step meetings for the rest of his or her life, the family or loved one support group meetings need to become a part of your life too. We recommend for a period of 2 to 3 years. Okay. So I think a common one we also experience is, I think for the first time, many of our patients that walk in here walk out and they think, wow, for the first time in my life, I actually feel like I'm medicated rightly, right? They might be on the actual medications they need to be, because part of a dynamic that unfolds with addiction is self-medication in some sense. The body kind of really is feeling a certain way. And you'll find very often that certain addicts choose certain drugs of choice, and those drugs of choice normally speak to the kind of pathology that they may be facing, right? And so they do enter into this kind of self-medicating pattern. And when they finally get onto the right medications, the medications that have longer releases, the medications that help address some of their behaviors, address some of their lack of inhibition, they really do start feeling a lot better. And that's a form of denial, right? That's a reality that we're facing, a reality where every kind of aspect of the reality is saying, yes, you are doing better, right? Your family is seeing it, you're seeing it, the doctor's seeing it, the counselors are maybe seeing it, everyone around you is kind of seeing it. But that, just because that is a reality for a couple of people in their treatment around them, doesn't mean that that's the actual reality, right? The actual reality is you could be working on your relapse in that very moment of feeling or speaking to this health constantly. Okay. Recovery by fear. So this is being scared of my problems will make them go away. A certain level of fear in early recovery is normal, as the pain of addiction is fresh in the mind of the addict as well as the family and loved ones. This pattern of denial works by self-deception. The addict deceives themselves that they don't need to change anything or do anything differently in order to stay clean and sober. All they must do is not pick up drugs or alcohol. They believe that fear by itself will help them accomplish this. Fear eventually fades and it will fade away. And when it fades away, what happens then is that they will eventually pick up again. As loved ones who have someone suffering from addiction, it's important that you assist your loved one whilst they embark on changing almost everything in order for them to stay clean and sober. Fear of losing a child, fear of losing work, fear of losing everything won't help the addict stay clean for the rest of their lives. It only may help them for the time being. Once they realize that whatever they are scared of losing isn't a reality anymore, they pick up the substances again. This is an important one because recovery by fear often plays into two aspects of treatment, which is exposure and sort of then the confirmation bias. So yes, we expose them to the fear. We expose them to the consequences of their addiction. And initially, there's this real fear that settles into their head. I can never touch anything again, right? And that's the main fear. But then what starts happening is they get overly exposed to the consequences, or they get exposure to the consequences, right? Or they get exposure every day to this fear. And what starts to happen is that they start really actually becoming quite resilient to the fear. They become quite resilient to the consequences because they've heard it now a few times. And that's when recovery by fear is really failing. And that's why recovery by fear is never sufficient because eventually your fears will subside. That's how it works. And a great example is your loved ones are sitting in here. Many of you are parents, right? How fearful were you the first day your loved one entered the world when you hold them as a baby? That fear as a parent was almost astronomical, right? But it subsided and subsided and subsided. And that's what eventually happens with addiction, right? And then the fear comes up again, yes, and we enter consequences, and maybe our loved ones entered toddlerhood, and all these fears were fresh again for us, right? As they started entering primary school, pre-primary school. But then it subsides, right? And you start to learn to trust the age that they're at. And this also then occurs here with recovery by fear. They begin to trust themselves again. They begin to not really focus on the fears as much. Yeah. Strategic hopelessness. Since nothing works, I don't even have to try anymore. For addicts that have been in treatment a few times, they may feel so hopeless that they haven't managed to stay clean and have a successful recovery to date and feel unworthy of recovery. When your loved one has been in numerous treatment centers, the hope that they will recover starts to diminish. In time, that hope may change to desperation, that they will never get well. We believe that recovery is possible, but the addict needs to work diligently, and the family needs to change the way that they support their recovery journey. Addicts do need love, but it's not in the same way that you love them in getting ill. Tough love is one option, and someone that supports them and gives them hope. We encourage families to support each other in every attempt at recovery, but not by enabling or bailing them out. Everyone deserves to recover. No one is too far gone to get recovery, but it requires commitment and change. Common one. As stated, we see this most often in people who have been in recovery a few times. And we also see how they derail the situation, right? Something might happen at primary, something might happen at secondary, something might happen at their home. And you as a family might even point out, but you're doing it again. There it is, happening again. And this isn't necessarily to, berate them. It's feedback. It's to help challenge their behaviors, right? And very often what you find with people who have been in that position, or people, especially with a real sense of low self-worth, that when you do give them that feedback, it's like, oh gosh, I'm right back where I started. And they completely catastrophize and go right back to the beginning and say, well, if I'm here again, I might as well use. That is a form of denial. Okay, that pattern has to be broken and challenged. And so when you see your loved one really jumping towards that catastrophe, oh no, it's to challenge that immediately and say, well, what are you doing now? Like, all I did was just give you some basic feedback, and now you're jumping to the worst case scenario. I think you need to be careful about how you think about this feedback. This feedback is simply just a challenge, right? The democratic disease state. I have the right to destroy myself, and no one has the right to stop me. As family members or loved ones, you might believe that the addict has a right to do what he or she wants because he is funding his own addiction, his or her own addiction, and believes they are not affecting anyone or hurting anyone. You might believe that they are old enough to do what they want as long as they are working and paying for their bills. The addict is slowly killing themselves, and they might not be stealing or hurting anyone with their addiction, but they're emotionally hurting everyone around them and fading away. And I'm going to add another thing there to say they might not be stealing or hurting anyone now, but it's a question of yet. Okay, it's always in addiction a question of yet. Just because it's not happening now does not mean it won't happen. What happens when they lose their job? What happens when they can no longer fund their addiction? They are going to turn to you and they are going to use you. That is the simple fact, because that's how addiction works. That's how it ends. Okay. So just because it's not happening yet doesn't mean it won't. Okay. The person who's suffering from addiction might admit drugs and alcohol are destroying their life, but no one can stop them because they have the legal and human right to continue on this path of destruction. Okay. Once again, we often think, and this is now a type of rationalization, justification. You'll see how they overlap. Even a form of compliance then falls into place here, where we think, yes, they have human rights. And that is the truth, they do, right? But they're also infringing on their own basic human right to dignity. They are actively destroying their own sense of dignity, their own sense of autonomy. The disease itself has robbed them of that. And so it's important to remember who's speaking now, the person with rights or the person with the disease. The disease that is robbing of them of their rights. Okay. Well, got through all of them. So in closing, one thing that the family needs to learn is that they no longer have to accept unacceptable behaviors in their life. May not be able to you may not be able to control the behavior of someone else, but you do have choices when it comes to what you find unacceptable, and often communicating that, right? We're not really in control of what we think, what we feel, but we are in control of what we say and how we behave and how we take accountability for that. So one of the ways we can take accountability um, of these thoughts, feelings, and behaviors is by setting boundaries. Setting boundaries is something that you have to do for your benefit, not to try to control another person's behavior, but to really show them where your limit lies. In order to effectively do this, it is helpful to detach to some degree, step away. So detaching is letting go of another person's alcohol problem and allow you to look at this more objectively, look at the situation more objectively. Yeah.
So we've run out of time for today. Changes Rehab thanks you for joining us at this meeting, and we encourage you to keep coming back.
Before we do that, sorry, maybe we just speak to any questions the family has. We do have 15 minutes. Sorry, I think we jumped the gun a little bit there. That was my fault.
No problem.
I told you to take us off. I didn't see the time.
So let's open the floor to questions. If anyone has a question, please just raise your hand or unmute yourselves, or you can also post it in the chat.
Okay, so maybe while we're waiting for the questions to come, just wanted to make an announcement from our side. As a clinical team, we decided that we're going to not run family support group on Tuesday, the 24th of December, plus Tuesday, the 31st of December. We know that most of you are used to us being there present every Tuesday, but the clinical team would like to spend time with their families. Those that aren't will be on call in the clinics. And if there's any emergencies, you could contact the helpline, plus the rehab. There will be people to stand by for you. But if you wouldn't mind, we are going to take a break for the 2 Tuesdays between Christmas and New Year.
It seems like we don't have any questions so far.
Ah,
Oh, there we go. Okay, so it says, how do you help a loved one that has had unfortunate events take place in their life and believe their situation justifies their drinking addictive habits?
Such a good question, hey?
Hmm.
Doesn't that speak about every single one of our patients?
definitely.
Yeah. COVID?
Yeah.
Yeah.
I think
Careful
that,
if... Okay.
yeah, the important part to start, or where one starts, is really realizing that this is some kind of justification, right? Realizing that this is a form of denial, this is a pattern of denial, and it's something they've been using for some time, right, to justify it. And once you start realizing that, it's to start challenging that. And I think there's various ways in challenging that. But I think one thing that we often use here is to really speak to, well, if we're really going to justify, let's go to the full extent, right? So if this is the reason, why is it that everyone isn't in addiction? Why is it that you find yourself in addiction with this particular case? And then you might find that there's more justification behind that. And it's to continually challenge that. It is difficult, and they will play on your heartstrings with this. And I think with this particular scenario, the denial is so incredibly strong. Um, and that's hard to break. But I think the important thing from you and the family is to continue to set these boundaries, continue to challenge the behaviors, to say, well, no, it's not really like that. This isn't the reality. The reality is it looks like you're using this as an excuse to drink. And it's not to detract away from the unfortunate events. It's not to detract away from the trauma. Those things happen. Those things are real. But those aren't reasons for using.
I think just to add there, it can be used as a form of denial strategies and tactics of manipulation and deflecting. So I think just knowing it, those words and those concepts and keeping them at the back of the mind and checking, is this manipulation or is this deflecting away from the actual issue, which is the addiction? Like Calvin said, not to discredit the trauma, not to discredit the emotions, the emotional effects of that trauma, but at this current moment, that's not where we're focusing. We're focusing on the destructive and the destructive behaviors of the addiction. So having those concepts in your mind and being aware and having that wise discernment when we're being confronted by really real experiences that we're affected by as well, as loved ones, we're affected by those experiences, those traumas of our loved ones in recovery.
Mm. I think one of the most difficult parts of our job in rehabs and clinical teams working with addiction is to try and get through to our clients that they use because they're addicts. No other reason. And we see trauma every hour of every day. And some of them have had trauma as a result of their using, and some of them had trauma prior to their using. But we have to focus on addiction treatment primarily, because if we don't help them stay clean and sober, we're not going to avoid future trauma. And we can get lost in the historical. And that's exactly why a lot of them have carried on using for so long, because that's their justification. I have to drink because I got a divorce. I have to drink because I lost a loved one. I have to drink because I had sexual trauma. And what we're saying is we honor and support, but they're not mentally ready to work on that trauma while they're in treatment. Some are blessed to go to secondary or to other facilities where they have an opportunity to work a bit deeper on the trauma, but most of them cover their trauma in their 12-step fellowship meetings over periods of time. So I think we as families, we get caught up in their trauma, which is often manipulation or good excuses. It's also a diversion. And I think for us as families, we hold on to that trauma because that's a justification, a reason why they drink and use. But if we can come to terms with the fact they use because they are addicts, and that's the genetic predisposition Calvin spoke about earlier. Some of it is socio-economic, some of it's psychosocial, some of it's socio psycho
Cultural.
cultural. But the bottom line is not everybody who drinks becomes an addict. Not everybody who uses becomes an addict. It's when the compulsion to use overrides everything else, and they will put that before the welfare of others. That's one of the ways we understand addiction. So all of your loved ones on this platform have had trauma. And a lot of you give us a hard time because you're saying we're not tackling the trauma. But scientifically, it's been proven that we have to treat the addiction first. If they stay clean long enough, then they have the mental capacity
And the
to deal
resilience.
with it and not fragment.
Okay. There's another question here. How do from Mike and Cynthia, how do you know that your loved one has now recovered, but it's manipulation? I think there's a simple one to that. I don't think there's such a thing as recovered. There's only in recovery. So it's just, how do you know your loved one is in recovery? And I think the easier answer to that, but it's a difficult answer, is to really question whether your loved one is practicing the tenets that they learn here around openness, willingness, and honesty. Because very often, if they are honest, they're not manipulating. If they are being open with you, there's a strong likelihood that they're not manipulating you, right? If they are willing, there's a strong likelihood that they're not manipulating you. That's how you know if your loved one is in recovery. Okay, there is no recovered.
Yeah.
I don't believe it. I
I
don't believe it.
agree. I think, you know what, I like to use short, sweet little, there's an old saying, the lady protesteth too much. And if an addict or alcoholic is telling you they're recovering or they're recovered, they're probably not, because their actions will speak far louder than their words. And actions aren't like that manipulation that we're talking about. You know, I'm so good and I've done so well. You'll just start noticing that your fears aren't as intense as they were previously. You'll start noticing that their conduct is improved. And your literally, it comes as our radar starts to settle a little bit. But if an addict tells me he's recovered or doing well, I'm not buying it. Because they need to lie, they need to manipulate because that keeps the disease alive. So yeah, actions
You know,
speak louder than words.
yeah, and in the converse, if they illustrate that they're in recovery, that's what it looks like. Recovery looks like openness, willingness, and honesty. So that's the exact converse of the previous behaviors. And so our goal really isn't recovered. It's just recovery. Stay in recovery. Be in recovery.
I think to add to that, I think trust the fact that we always tell our patients that you're the experts. You know, you are the experts of recovery because or of addiction, and if you've gone through recovery as one, you as loved ones are the experts of knowing your loved one's addictive behaviors. So if you sensing that emotional reactivity in yourself and that concern, then most likely it's not there because you're fathoming it up out of some mystical thought. It's because you're noticing subtle changes in behavior and complacency within their recovery. So trust your intuition, trust that concern. Yeah, as Cheryl said, I was going to say it as well, as like as soon as we tell our clients, even, as soon as you say, oh, I've got this under control, you've blasted away all your steps because you've just literally looked step one in the face and said, okay, I don't accept you.
Yeah.
As long as you say I've got this, it's under control, or I'm okay, then you're actually on your way to relapsing through that statement.
Then the next question, we've got very little time. So maybe we'll just try and deal with the next one and see how it goes. How do you deal with a loved one who tends to believe that they no longer direct interventions, as they believe they have figured out how to deal with their problem? For instance, a guy says, I don't need any more therapy, as I now know that all I need to do is stop taking the substances. Or he says that I have not taken for such a long time and believe that I have overcome the urge to take the substance. I think it speaks to a lot of what we've been saying, and it's to really challenge that way of thinking, to challenge their
Mhm.
unwillingness, right? Um,
Yeah.
to say, hang
And
on,
denial, isn't it?
yeah, it's all
Denial and
denial.
manipulation.
Hmm. Okay.
And for the person who asked that question, please keep coming back to this group because we'll answer more and more of your questions each week. But really, ultimately, there's a saying, how do you know when an addict is lying? When their mouth is open. And that doesn't necessarily pertain to when they're in recovery, but prior to recovery and prior to treatment, whatever they're saying is not true. When they come into treatment, that's where what we said earlier about conduct and versus words. Addiction isn't, they can't control it. You don't learn how to stop taking a substance. We don't sit in group therapy and say to them, drugs are bad, don't take them.
Hmm.
We start teaching them that they are powerless over the narcotics
Hmm.
and their life became unmanageable. And we work on that unmanageability to dismantle denial.
Hmm.
So if they're saying that they just need to learn to stop taking the drugs, they're in denial.
Hmm.
And that's where the family needs to learn more and get more support.
Hmm. And I think it's important to remember bearing in mind the first few slides, the function of denial. It's always control or avoidance. And so really what we're saying is that there is a very little congruence when it comes to denial. So their thoughts might, or their words might not really be matching up to their actions, or their actions might not necessarily be relating very well to their emotions, right? So what you're constantly looking in your loved one is you're looking for congruence. You're looking for, is everything actually matching here? Um, or are you actually just avoiding the situation? And that's generally how we operate too. We look at the congruence of what you are saying. Are your thoughts matching what you're saying? Are your feelings matching? Are your behaviors matching? Is what your family's saying matching? Is what your work saying matching? And when we start to really pick it apart, you start to find very, very, very quickly that nothing has congruence.
Mm.
And so it's to really be keeping your eye out for the congruence.
Yeah.
Okay. Even just
Okay.
tone. Sometimes it's in the tone.
Can we quickly skim through the next two?
Sure.
Hi,
So,
our daughter suffers with depression and bipolar, takes a cocktail of meds and seems to sleep all day. Why? Please advise. Um,
Gary, just to speak to the preamble in the front, maybe you missed it. We tend to not address primary care patients' difficulties while they're in treatment. Okay. So as valuable as your question is, you can direct it to your counselor, to the counselor, that's on, or to the counseling number here, and we'll address your question more privately. And that's just to protect the anonymity of your loved one. Okay.
yeah,
But
and
so
if
we
I
do
can just
value
give
your
an
question.
overall picture, many patients present with bipolar and require medication. Addiction is about avoidance and escape. So many people use substances, pharmaceuticals or other, to sleep. And that's what we would like you to raise with the counselor when they please call you. So those are the primary care issues we're talking about. Then the next one is when my loved one is out of rehab, how do I deal with the fact that I cannot trust him to go anywhere without me and the risk he may drink again? Okay, I'm going to do this in like 10 seconds and then Calvin, you and Jordan can zip as well. Trust is a process. It's our responsibility, not theirs. And you cannot follow your loved one around to stop them from drinking. Please use this platform. Go to Tough Love meetings, go to Naranon and Al-Anon meetings. We need to get help for ourselves. For anybody who's told you they've policed their loved one, it made them mad. That's not what recovery is. Recovery is about taking responsibility.